And so this is our housing and social equity program, and it is all about how a lack of affordable housing, the COVID-19 crisis, and our upcoming winter are stretching available housing resources. Sorry. Local organizations are collaborating to create new resources. So join us today as we explore these new innovations in emergency housing, temporary housing, and permanent affordable housing. So we're going to kick it off in just that order. We're going to start with Laura Jaworski, from the House of Hope CDC, and she is going to tell us all about their proposal for Echo Village. Laura, if you're ready.
Yeah, thank you so much, Amy. And I really appreciate the opportunity to be here, and in particular to have this conversation as well, joined with Christine West and her team over at Kite. This has been kind of a whirlwind year for us. And I was just reflecting last night that never in a million years, 12 months ago, did I figure that this would be where House of Hope would be in terms of what programming we'd be contemplating. Of course, never mind the impact of COVID. So again, as Amy said, my name is Laura Jaworski. I've had the honor and privilege of serving as the executive director for House of Hope CDC for the last 4 years, but I've been with the agency for close to 6 and doing work in the housing and homelessness arena for, I don't know, before I started having to color my hair. So about 10 years or so, which means I've had kids. So it's all that. Grown up in this sector. So a little bit about House of Hope. We actually celebrated our 30th birthday last year. Thank you. Yes, it was wonderful. We had a bit of a nonprofit wedding where we had people in the room with us that loved and cared about our work and our mission and our impact. And we hadn't had an event like that in a long time. So it was really wonderful. And so just to teleport us back in time just a small bit, we started in the late 80s, back in the day when there was really no access to shelter for folks, particularly nights and really over the weekend. So our founder, Jean Johnson, and a number of her friends at the time really started banding together and created their own night-to-night shelter. So really had their own grassroots impact, meeting the needs of families experiencing homelessness in the city of Warwick, which is also not necessarily a community that really comes to mind. Usually we're thinking about urban settings when we're thinking about homelessness. So really drives home the point that homelessness is really touches every city and town. So really from there, our homeless services grew over time. At the same time, we worked to develop affordable housing because we really felt strongly that we couldn't just do the work of delivering services, that we actually had an opportunity to contribute on the development side. So we had a small but mighty pipeline going along over the years in developing affordable housing in the city of Warwick, and doing our homeless services in the city of Warwick, but really growing that and expanding that and establishing our foothold in homeless services work throughout the state. So maintaining that presence statewide. Most recently, though, really in the time that I've become the executive director, we have really been hyper-focused on challenges around the growing numbers of folks experiencing street homelessness, and have done some innovative work in that area, particularly our Shower to Empower mobile shower truck, which if those of you are in and around the city of Providence, that's us, where we are providing showers, haircuts, and medical services, navigation services to those facing street homelessness in the city of Providence for the last number of years. So just to put it into some context, because I'm talking about the growing number, last year there were over 4,000 Rhode Islanders that experienced homelessness statewide. That translates to about 1,000 on any given night. And that really only accounts for those that are in an emergency shelter setting. That does not account for folks that are unsheltered or living in a place not meant for human habitation is the phrasing that HUD likes to use for that. So that means an encampment, that means in a vehicle, either a car or an RV or other sort of trailer type, or quite literally on the streets, as it were. That number is actually, by best estimates, confirmed at 325 through a count that we did this past September, but in fact is more likely close to double that. Because we're not able to officially include those people in our database because of where we may be in the data collection point with them. But we know that's a growing number. And to just add a little bit more context, that unsheltered number has been doubling every single year for the last few years. So when I talk about the growing numbers unsheltered, my street team is out there and is watching this happening. And last winter really was quite concerned. We here in Rhode Island have a year-round shelter system that, again, has been really trying to work hard to move people towards housing. But the challenge is that we then add winter beds in the winter season as those folks that are unsheltered, as I mentioned, are out and come inside. We barely scraped by, as I said, last winter with the additional beds that needed to be brought online for that year-round system. So really we're concerned, holding our breath through the last winter, trying to make some options available. Thankfully, our partners at Amos House, they pulled together something really quickly, and we kind of made it through. And then COVID hit, right? So that just sort of was the unraveling of all of the things. My team was encountering people who had no idea that COVID was a thing. They thought it was just another fluke. And had no idea about the guidances that were coming out from not only our state officials or the municipal officials, but the CDC. So my street-based outreach team really became ad hoc public health workers. I was arming them with masks, hand sanitizer, as people were unable to go into spaces that they normally went into to warm up or to stay cool, to power their devices. They were no longer able to hop on Wi-Fi systems. Those Dunkin' Donuts, those McDonald's, those Burger Kings, those safe spaces were unavailable. And at that, they had no more access to hygiene facilities. So that's where they were going. And oftentimes, addressing hygiene needs, not only just toilet needs, but hand washing and even times body hygiene needs. So really that removal was a big impact. And so we were really grappling with this tension of how do we address hygiene at the same time when we're in a public health crisis. So we were trying to pivot as much as we could all through this. We were buying solar chargers so that we could hand those out to people where they couldn't plug in their phones. They could plug it into this solar charger so they could stay connected. Trying to do those things a few steps ahead until they were made available more widespread through the state as the state was really working hard to catch up and respond in so many areas. So we were doing our best on the front lines and even kept Shower to Empower up as long as we could, but eventually did need to ground that as we were concerned we would become more of a vector of transmission than anything else. So that was a sort of a heartbreaking day for us. But my staff really was amazing. They detoured. Instead of having Shower to Empower, we did Trunks to Empower. They were going out, they were on the streets, trying to do everything they could to distribute supplies, but to distribute information, which was vitally important. But still saw this need growing. Shelter demand was quadrupling. We actually lost about 150 beds in our emergency shelter system due to the physical distancing requirements that needed to be put into place due to COVID. So it was harder and harder to get in. Demand was increasing. And of course, the human need was increasing in significance as well. So in some of all this, we sort of found a few moments to catch our breath, and we're really toying with different innovative ideas and we could meet the needs of folks that we were serving. And we landed on tiny houses. We had tossed this idea around off and on and started to think about what that might look like for our work. And Christine, I know we'll get to that later. But we were actually really exploring it beyond it, not just this HGTV type of idea that people like to hearken at tiny homes to, but in particular, our area of expertise is with those experiencing chronic homelessness. In a tiny house, the small square footage is really stabilizing and less traumatizing than perhaps a much larger apartment space for them. So it was a really wonderful first step up. But how are we going to meet the needs right now? What were we going to do? And so as we were researching tiny homes for permanent housing, we stumbled upon communities that were using what are called pallet shelters, which are temporary shelter structures. They're sort of likened to like if IKEA could make a tiny house, it would be a pallet shelter. And they have a wonderful website to take a look at. They're based out in Washington, and a tiny house that they construct, these pallet shelters. Each one is assembled within 30 minutes with minimal tools. They come as 7 pieces, quite literally, for 4 walls, 2 pieces for the roof and 1 for the flooring. And as we really started to talk about the feasibility of this, we engaged in a conversation with Pallet, the company, and worked with them about what it might look like for this as an intervention tool in New England. They weren't doing this in really this side of the, what is it, the Mason-Dixon, or above the Mason-Dixon, and this side of the Mississippi, I guess. So this was a first for them as well. So they were really challenged, and we're really working hard to address the insulation needs so that something like this might be able to withstand a cold Rhode Island winter, whether that be wind, snow, or the like temperatures. So from there, we were off to the races, and Echo Village was born. Echo is actually an acronym for Emergency COVID Housing Opportunities. So we really felt this would, as we were seeing what was happening in the congregate shelter setting, having folks live in a temporary structure, a tiny house type structure, what we could do was create smaller pods of people. So instead of having somebody sleeping each and every night in a large congregate setting, so it might be 60, 70, 100 people in one big gymnasium, what a difference it would make in the mitigation of COVID-19 if we could have 2 or 4 people in each of these structures. Give them a safe, stable place to sleep every night, a door that locks, a place to leave their things. No fear of them needing to leave their encampment, perhaps, or their vehicle, to come back to have that vehicle towed or their encampment destroyed or things stolen. So for a lot of reasons, it checked off a lot of boxes. So we're really pushing forward on this notion where Echo Village is this a community of 30 pallet shelters. Because of the way we're Tetrising the beds, we are envisioning 100 beds in total. So 100 folks would be able to come in and sleep there. And we've also been really ambitious because we're concerned about what the winter can bring. It snowed the day before Halloween in Rhode Island. We are really being very aggressive. In the last 90 days, we have secured or tentatively secured almost 75% of the expenses for this project. So we've been hustling really aggressively to not only get the funding in place, but to get this thing stood up. We had hoped for early December, but we hit some snags, but right now it's looking pretty good for the end of December to be stood up to immediately meet the needs. So when we think about the growing needs of folks on the street, the lack of emergency beds that are being brought online, 100 beds will immediately infuse our system with a much needed release valve to keep folks safe and stable, healthy, and really for us, most importantly, dignified. So I'm gonna come up for air there because I know I just said a lot.
That is amazing. Can you talk a little bit about what the community, the unhoused community feels like? Have you shown them pictures of I imagine there's been some research that way too.
Sure, yeah. We've actually, through our research into tiny houses, when we were thinking about them only as permanent housing opportunities, we didn't want to approach this problem and say like, we think this alone is the solution, and to sort of impose that on folks who are unhoused. So we've actually been really thoughtful. Last spring, I think it was, early summer, we conducted a survey of folks. So my outreach team, we still had student interns with us at that point in the game, but they really were going out into the encampments or working with my outreach team specifically and surveying people and saying like, what's important to you? And I don't want to steal Christine's thunder because they're going to really hit on this some more, but there were a lot of reflections that came from that. So it affirmed that we were onto something in terms of what they need and what they were seeking. The other piece is that have been doing this work for a long time. And for us, one of the cornerstones of our approach is that we show up for folks both literally and figuratively. And you build trust over time by doing what you say and saying what you do. And my team takes that to heart each and every day. So they've been having some of these kind of conversations about what it is that you need and what would that really look like? So those two things sort of put together was sort of the objective and the subjective, the art and the science, if you will, to really know that we were onto something and that this was a real gap we could fill.
And then I want to ask you, of course, about tonight. Do you want to say anything about what's going on tonight, or do you want me to say it?
No, well, thank you, Amy. I appreciate that. So one of the ways that really allowed us some time to think about tiny houses as a solution, as I mentioned, we were really playing with this idea about a year ago. We are in January. I started as a cohort in the nonprofit innovation lab with Social Enterprise Greenhouse and the United Way of Rhode Island. It was we're the inaugural class, if you will. So I went through a process with 9 other nonprofits. And from there, we were incubating the idea of utilizing tiny houses to address social determinants of health and housing. And that's where we started working with Christine and coming around with Kintsugi Place. But again, as we were in the research sort of phase of that work, that's when I discovered Pallet Shelters. And COVID was hitting, and all of a sudden we had this sort of light bulb moment. So all said and done, we made it through the first round, where first there were 10 and now there are 5. So the final round of pitches are happening tonight at 4:30. Myself and 4 other amazing nonprofits are putting forward our pitch for innovative ideas we've each been working on. And so I'll be delivering my pitch, where we'll cover both how we're using tiny houses as an intervention, as a tool right now. So a bit on ECHO and a bit on Kintsugi, so temporary and permanent structures. So by all means, make sure you register if you're around. We'd love to have you there to hear what we're doing and hear what other nonprofits are doing, because it's not just about us. So by all means, I believe the link is it's on our Facebook page, House of Hope's Facebook page. It's on our LinkedIn page. I'm sure it's on SEG and United Way. So just make sure you register, because as a participant, as a viewer, the audience will also get to vote and designate a People's Choice Award. So you'll have a little bit of skin in the game and get to choose your favorite and allow one of us to get an extra $5,000, which is really exciting for our project. So hope to see you there.
Definitely. So I did just drop in the chat, if anybody else has any questions for Laura and you'd like to unmute yourself, I can keep an eye on the participant list real quick. Feel free to do so. Let's hear what you think of the project and how you feel about it. I have one more question for you, Laura. And this is more about the showers to empower, and when COVID first hit, we heard a lot about how people were having trouble finding places to wash their hands. Is that still an issue that you're seeing in your community? And if so, is there anything, any remedies that you've been able to adapt? I know that with Showers to Empower being shut down, the full body cleaning is not as available, but
yeah, one of the first things that we advocated for, once those public spaces were closing down, we came out of the gate strong and really demanded the state provide porta potties and hand washing stations. There was a real inequity there, an imbalance about many folks being told to wash their hands, and here we were leaving folks without ready access to do so. We worked with the state on identifying locations to have those dropped in and around, a lot of it in the city of Providence, but Pawtucket and other communities as well. Shower to Empower was grounded for 3 months, so April 1st to about July 1st. So she got back on the road, but at a limited schedule. So we're still offering that 2 days a week around the city of Providence. There were adjustments made to hand washing, but at the same time, we know that places have opened back up, so people are able to go back into those Dunkins and McDonald's and places like that. But of course, it really harkens back to this. There's a great inequity there around access. And we really see a direct line, and it just sort of bolsters our argument about that housing is healthcare and health is housing, and really it demands that people do more. We've been beating the drum in this sector for the longest time: less shelter, more housing; less shelter, more housing. But we just haven't kept pace. And now here we are in a space where we really need to do something. So when I said at the top of this, never in a million years did I think 12 months ago that here I would be pushing for a 100-bed shelter. It's not the game I wanted to be in, but we had no idea a pandemic was on our hands. And so we really felt, again, we're innovative, and really felt that we were in a position to push forward for something that our folks were demanding that we serve. So when we came across Pallet Shelters, it really checked a lot of the boxes, particularly around health and wellness for us, in addition to safety and security.
Absolutely. And Marie had a question about how are you securing space or land for this project, or where's the plan? What's the plan?
Yeah, so for Echo Village, we are working with a private property owner in Pawtucket for this particular site. So,
yeah, wonderful, wonderful person to be able to provide some space for that. Okay, and then Tootie's question, of course, and one that we always try to ask is, how can we help? What can we do as a community to support House of Hope?
So the first thing we say right off the rip at House of Hope, when you ask any number of my staff, is to see and acknowledge folks that are impacted by homelessness. That's the first thing. Is we say be a human to humans, look somebody in the eye and acknowledge their existence, and that goes a long way. And from there, you can advocate, of course, voting. We just had a massive election, obviously. So really getting engaged and involved civically that way, pushing for this as an issue. You can volunteer. You can collect socks and underwears. You can collect toiletries. I have 100 bodies that I'm going to be supporting very soon. So that's a lot of soap. So, those kinds of items, winter clothes, those sorts of things are really valuable. So your time, your talent, or your treasure. Volunteering, lending your expertise into the nonprofit sector. We really need you on boards. We are going to need you to help distribute stuff and collect items. And then, of course, if those things don't work for you right now for any number of reasons, of course, you're always welcome to donate to support. There's always lots of gaps in this nonprofit field that need to be filled to keep our missions rolling forward. So there's if you visit our website, which I believe maybe we can drop it in the chat, but it's just thehouseofhopecdc.org/donate. And that just will bring you right to our donate page. And when you land there, we keep an up-to-date listing of items that we need, socks, toiletries, and the like, but also gift cards. We often are distributing those items to folks that we're working with. So, $5 at Cumberland Farms goes a long way. $5 at McDonald's goes a long way. It gets people access into those spaces. A lot of times you have to pay to use a restroom facility in those spaces too. So it gives them more than just a hot meal. It gives them access into a hygiene facility as well, and power, electricity, Wi-Fi. So there's a lot that comes from that specifically.
That's a very great point, and I know that that's something that a lot of people ask at this time of year is how do we help if we're not experts? What do we need to send?